Urologist explains why baking soda improves blood flow in men over 60. Many men eventually encounter a silent, reflective moment, perhaps while standing before a mirror or amidst the quietude of personal solitude, when a subtle but undeniable truth begins to surface. A sense that their physical vitality, once a dependable constant, no longer possesses the same robust strength or vibrant responsiveness it once commanded. This realization rarely arrives abruptly, a sudden shock to the system. Instead, it tends to insinuate itself gently, almost imperceptibly, over a progression of months, sometimes even stretching across several years, like a slow-motion tide receding from the shore. It manifests as a gradual diminution, a barely perceptible loss of that youthful fullness, a frustratingly delayed response when spontaneity is desired, or an unsettling sensation that aspects of one's physiology, previously taken entirely for granted, now demand considerably more conscious effort, or, in more disheartening instances, fail to respond with any discernible vigor at all. If one engages in genuine introspection, a quiet but persistent whisper may already have begun to echo within the recesses of the mind, articulating a dangerously limiting belief. This is merely the inexorable march of aging. This is simply the inevitable consequence of surpassing 60. Perhaps this chapter of my life, with its associated freedoms and capabilities, has regrettably concluded. I urge you to pause at that very thought, to hold it and scrutinize it, because such a belief is not only fundamentally incomplete in its understanding of human biology, but is, in a significant number of cases, demonstrably incorrect. What if I were to unveil a remarkably potent tool, one capable of fundamentally restoring crucial blood flow, enhancing tissue fullness, and revitalizing vascular responsiveness? A solution that bears absolutely no relation to the myriad of commercially hyped blue pills, painful injections, or exorbitantly priced supplements often concealed behind a veneer of flashy marketing and extravagant, often hollow promises. What if I were to reveal that this transformative aid is not some futuristic medical breakthrough or an exclusive, hard-to-find ingredient, but rather something already residing within the familiar confines of your own kitchen, most likely nestled innocently beside your bag of flour? The substance I am referring to is nothing more complex than sodium bicarbonate, plain, simple, and universally accessible baking soda. I can almost hear the immediate skepticism forming in your mind, the internal dialogue questioning the very premise. Doctor, how could something so mundane, an ingredient I primarily use to bake cookies, possibly hold the key to enhancing my performance and vitality? I implore you to set that initial doubt aside and remain with me through this explanation, because in this detailed exposition, I will systematically guide you through 5 clinically substantiated, yet regrettably often overlooked, mechanisms through which bicarbonate can profoundly bolster vascular health. Furthermore, we will explore the remarkable transformations that occur in terms of physical size, inherent responsiveness, rekindled confidence, and unwavering reliability when the vital flow of blood is no longer impeded by internal restrictions. If you find yourself in your 60s, 70s, or even navigating the landscape beyond, and you sense that your inherent vitality, your distinctive edge, is gradually diminishing, please understand that you are far from alone in this experience. However, it is equally crucial to recognize that you are not irrevocably broken. In a vast majority of such instances, what you are grappling with is not a permanent, irreversible loss of function, but rather a more manageable condition of restricted circulation. Consider it analogous to rust gradually accumulating within the pipes of an old plumbing system, impeding the flow, rather than an irreparable structural damage to the fundamental system itself. Before we delve deeper into these mechanisms, I would genuinely appreciate it if you could take just 2 brief seconds to inform me in the comments section where in the world you are currently watching from. We have men from every corner of the globe tuning into these discussions, and the sense of community that arises from seeing that collective engagement holds far more significance than you might initially realize. And if you genuinely believe that men deserve access to shame-free, scientifically rigorous, and evidence-based health information, then I urge you to hit that like button right now. Your simple action helps to ensure this vital video reaches countless other men who are currently struggling in silent isolation, men who mistakenly believe they are the only ones contending with these deeply personal challenges. For those unfamiliar with my background, my name is Dr. Altha, and I am a board-certified urologist possessing over a decade of intensive clinical experience. My professional dedication has been almost entirely concentrated on providing comprehensive support to men over the age of 50, 60, and 70, helping them safeguard their prostate health, optimize their sexual wellness, and sustain their long-term vitality. It is imperative to underscore that all information shared here is purely educational in nature, rigorously clinically informed, and specifically designed to augment and support rather than ever replace the personalized medical care you receive from your own personal physician. Now, let us confront a profoundly damaging and pervasive myth head-on, a belief that has needlessly constrained countless men. There exists a widespread societal conviction that once a man advances past the age of 65, his body is inherently destined to naturally shrink, weaken, and progressively shut down, and that crucially, nothing meaningful can be done to counteract this supposed inevitability. This belief, while deeply ingrained within cultural narratives, is profoundly misleading and, from a biological standpoint, unequivocally inaccurate. In a significant proportion of men, what is mistakenly perceived as permanent and irreversible loss of function is, in reality, a more dynamic and treatable condition of vascular restriction. To truly grasp this concept, consider your arteries, the vital conduits of your circulatory system, as analogous to a series of garden hoses. Over the course of many decades, the cumulative effects of chronic inflammation, pervasive oxidative stress, and an insidious internal acidity contribute to the gradual development of stiffness within these arterial walls, much like a persistent kink or obstruction forming within that garden hose. When such a kink develops, the hydraulic pressure inevitably drops, the essential flow of water, or in this case, blood, decreases dramatically, and the hose's capacity for flexible responsiveness fades. Consequently, the surrounding tissues that rely on this vital flow may appear smaller and feel less firm. However, the fundamental structure of the hose itself has not vanished. It simply requires a thorough clearing of the obstruction, not a complete and costly replacement. This fundamental principle underpins my entire approach. It is not predicated on promoting miracle cures or peddling false promises. Instead, it is meticulously focused on optimizing your internal physiological environment, thereby enabling your body and any prescribed medications you may be taking to function precisely as they were originally designed to. And it is at this critical juncture that bicarbonate elegantly enters the conversation, offering a surprisingly simple yet powerful intervention. Your skin, that remarkable outer covering, is not merely a solid, impenetrable barrier. Instead, it functions as a sophisticated, semi-permeable membrane, allowing for a controlled exchange of substances. When the delicate tissues beneath its surface become engorged and congested with an accumulation of metabolic waste products and localized acidity, their inherent elasticity suffers profoundly. The microscopic blood vessels nestled just beneath the surface, the microvasculature, struggle immensely to expand and contract freely as their natural pliability is compromised. By strategically utilizing a localized alkaline soak, you effectively leverage the principles of osmotic pressure to gently and non-invasively rebalance the pH of these affected tissues. As the localized inflammation begins to subside, the previously constricted microvasculature gradually opens up, tissue elasticity improves demonstrably, and the vital blood volume within those tissues naturally increases. It is a transformation akin to meticulously removing a tightly wound rubber band from a compressed sponge. Suddenly, the sponge can fully absorb and expand once more, The practical application is straightforward. Simply add 2 tablespoons of aluminum-free baking soda to a basin of warm water. Soak the affected area for a duration of 10 to 15 minutes, repeating this beneficial practice 2 to 3 times per week. It is crucial to exercise caution and avoid using this method on broken skin or in the presence of active infections. Always rinse the area thoroughly afterward and apply a suitable moisturizer if your skin feels dry. A phenomenon often reported by men who adopt this practice is something quite unexpected. Not merely a positive physical change, but a profound sense of psychological relief. When tissue visibly appears healthier and consistently responds with greater vigor, a quiet but potent return of self-confidence begins to emerge, naturally and reassuringly. As we progress through the natural stages of aging, the efficiency of our kidneys, those tireless filtration organs, can regrettably decline. This gradual reduction in kidney function frequently contributes to a state known as low-grade metabolic acidosis, a subtle but pervasive physiological condition intrinsically linked to a cascade of undesirable symptoms, including persistent muscle fatigue, general stiffness, and critically, systemic vascular constriction. In essence, an overly acidic blood environment signals the delicate, smooth muscle tissue lining our blood vessels to tighten and contract. Bicarbonate, when introduced into the system, acts as an extremely effective physiological buffer, gently nudging the internal pH of the body toward a healthier, more balanced state. This subtle shift in pH, in turn, acts as a crucial signal to the smooth muscle tissue, encouraging it to relax. Relaxed blood vessels are functionally superior. They facilitate significantly better blood volume, ensure a more robust and responsive physiological reaction, and inherently present less internal resistance to the circulatory flow. The recommendation for this internal optimization is simple yet potent. Dissolve half a teaspoon of baking soda in 8 ounces of water and consume it in the morning on an empty stomach. The slightly salty taste is perfectly normal and indicative of the active ingredient. For those who find it challenging, a squeeze of fresh lemon juice can notably improve its palatability. It is absolutely imperative that if you have pre-existing high blood pressure or are currently adhering to a sodium-restricted diet, you consult with your doctor before incorporating this practice into your routine. Many men describe the profound shift experienced through this internal alkalization as a sensation of feeling fluid again, akin to the surprising relief of releasing a parking brake they hadn't even realized was engaged. Now that we have established a clear understanding of how strategically alkalizing your internal environment plays a pivotal role in effectively opening the pipes of your circulatory system, we must pivot to discuss another equally critical aspect: why so many dedicated men, despite diligently engaging in what they believe are the right things, are persistently failing to see the tangible results they earnestly seek. Many individuals watching this very explanation are by no means careless or negligent regarding their health. On the contrary, you have likely invested considerable time, effort, and financial resources into trying a vast array of supplements, including various nitric oxide boosters, beet powders, L-arginine, L-citrulline, and perhaps even advanced prescription medications. Yet, despite these concerted efforts, the results consistently feel inconsistent, disappointingly weak, or frustratingly short-lived. This lack of sustained success is not, crucially, because those tools themselves are inherently ineffective or flawed. Rather, it is because they demand a specific and optimal internal environment in which to function to their fullest potential. Nitric oxide, for instance, is globally recognized as the master signaling molecule responsible for instigating vascular dilation. Its primary physiological command is to instruct blood vessels to relax and expand, allowing for increased blood flow. However, nitric oxide is inherently fragile. Within an acidic and inflamed bloodstream, its delicate molecular structure breaks down almost instantaneously, rendering it ineffective. It is a futile effort, much like attempting to light a match in the midst of a raging windstorm. The potential for ignition is there, but the hostile environment prevents its expression. Bicarbonate, in this context, does not actively create more nitric oxide. Its crucial role is to meticulously protect it. By effectively buffering systemic acidity and significantly reducing oxidative stress, bicarbonate creates a more hospitable internal landscape. In this optimized environment, nitric oxide remains active for a considerably longer duration. The result is not brief, fleeting spikes of dilation followed by rapid fade, but rather sustained and robust dilation, leading to significantly better blood volume and consistently more reliable responsiveness. To maximize this synergistic effect, it is advisable to take bicarbonate approximately 20 to 30 minutes before consuming nitric oxide-boosting foods or supplements. You can conceptualize bicarbonate as the diligent stage crew, meticulously preparing the entire environment. Backstage, ensuring that the main performance can not only proceed, but truly flourish. There is yet another insidious physiological process, largely unrecognized and rarely discussed with men, which contributes significantly to these age-related changes. It is aptly termed inflammaging. This refers to a state of chronic, low-level systemic inflammation that insidiously accumulates and builds up over many decades, often without overt symptoms. Unlike acute inflammation, which manifests as sharp pain, redness, or swelling, this persistent low-grade inflammation does not typically cause immediate, sharp discomfort. Instead, its destructive work is far more subtle and quiet. Over time, it quietly, yet profoundly alters the fundamental structure of delicate tissue, progressively leading to a condition known as fibrosis. Fibrosis is characterized by the formation of stiff, non-elastic tissue, which loses its natural pliability and capacity for expansion. Even in scenarios where adequate blood flow is restored, fibrotic tissue simply cannot expand properly or respond with the necessary suppleness. The good news is that bicarbonate has been scientifically demonstrated to effectively reduce various inflammatory markers, such as C-reactive protein. When this chronic inflammation decreases, a virtuous cycle begins. Tissue elasticity gradually improves, the inherent expansion capacity returns, and a general sense of physical comfort significantly increases. For this specific benefit, a pulse approach to bicarbonate consumption is often recommended. Take 1/4 teaspoon daily for 5 consecutive days, followed by a 2-day break. This strategic cycling supports the body's delicate internal balance without inadvertently suppressing its natural buffering systems, allowing them to remain robust and active. Moreover, there is a profound psychological shift that accompanies this physical restoration. When your body begins to respond predictably and reliably once again, the insidious grip of anticipatory anxiety begins to fade. Your own body ceases to feel like an unpredictable opponent and, instead, progressively transforms into a trusted and steadfast ally. One of the most harmonious and internally balanced ways to integrate bicarbonate into your daily routine is through a synergistic combination with fresh lemon. This potent morning elixir consists of 8 ounces of filtered water, 1/4 teaspoon of baking soda, and the freshly squeezed juice of 1/2 to 1 entire lemon. This concoction is ideally consumed approximately 20 minutes before breakfast. Each component plays a vital role in this alchemy. The potassium present in the lemon effectively balances the sodium from the bicarbonate, preventing potential electrolyte imbalances. The citrate, also abundant in lemon, significantly enhances the overall alkalinity of the mixture within the body. And of course, the bicarbonate directly acts as a powerful buffer, neutralizing internal acidity. Men who consistently adopt this morning ritual frequently report significant improvements in morning responsiveness and a palpable increase in overall consistency in their physiological functions when used regularly. Starting your day with this deliberate and health-affirming practice sends a powerful and unmistakable signal to your entire nervous system. My vitality truly matters. This profound mindset shift, this renewed sense of self-worth and commitment to well-being often cascades into a myriad of other positive lifestyle changes. It can inspire better food choices, encourage more physical movement, promote deeper and more restorative sleep, and fundamentally foster a heightened sense of self-respect. These interconnected changes in turn compound over time, creating a powerful upward spiral of enhanced health and well-being. Now let us synthesize all this information into a practical, actionable plan that you can realistically implement starting today. For the initial 14 days of this protocol, your singular focus should be exclusively on optimizing your internal chemistry. This means consistently adhering to the morning drink. That's it. No complicated stacks of supplements, no obsessively chasing fleeting sensations, just this foundational internal adjustment. Consider this initial phase as the crucial period for clearing the rust from within your system. Following this foundational period, from day 15 through day 30, you will continue with the consistent morning drink, but you will also strategically incorporate the localized alkaline soak performed twice per week. This second phase is designed to allow the profound internal improvements you've cultivated to effectively translate into tangible outward tissue responsiveness and pliability. If for any reason you find yourself unable to commit to the full protocol, please prioritize and stick diligently with the morning drink alone. That internal pH shift, that fundamental rebalancing of your body's acidity, represents the single most powerful lever for enhancing and sustaining your vascular health. Every other intervention or practice is, while beneficial, ultimately additive to this core principle. It is absolutely vital to manage your expectations realistically and compassionately. You are not going to miraculously awaken tomorrow morning with the physiology and vigor of a 22-year-old. Harboring such an unrealistic expectation will only invariably lead to disappointment and disillusionment. Instead, what the vast majority of men consistently report noticing is a more gradual yet deeply satisfying array of improvements: an increased sensation of warmth, a welcome feeling of fullness, significantly improved morning responsiveness, a marked reduction in generalized anxiety, and a more consistent and reliable overall performance. These are the true indicators of success, representing meaningful and sustainable progress. This entire approach is not about chasing an elusive fantasy. It is profoundly about protecting, preserving, and restoring essential function, fostering unwavering confidence, and safeguarding your inherent dignity. Far too many men endure in quiet suffering, believing that any discussion of this deeply personal topic is inherently embarrassing or taboo. I assure you, it is not. This is not a matter of shame or inadequacy. It is, quite simply, a matter of fundamental biology. I encourage you to drop a comment below and let me know which specific step of this protocol you intend to start with. Please hit the like button so this vital information can reach countless other men who are desperately in need of it, but may not know where to turn. Subscribe to this channel for weekly evidence-based strategies and insightful discussions designed to empower your health journey. And finally, please consider sharing this video with just one man in your life who might genuinely benefit from this information, but perhaps due to societal pressures or personal discomfort might never actively ask for help. Remember this profound truth: aging does not, under any circumstances, equate to surrender. I am Dr. Altha, and always remember, vitality is an active, ongoing practice, not a finite destination to be reached and then forgotten.